Today I'm going to discuss few question and answer about the physical assessment. This question and answer we collected from previous NCLEX licensing exam. It is the board question. The first question here, a nurse is performing a cardiac assessment. Identify where the nurse placed the stethoscope to best auscultate the pulmonary valves. So the second intercostal space, the left or right, which one? The correct answer is pulmonary area is the second intercostal space to the left, but aortic area, second intercostal space to right. If you see this picture, aortic, second intercostal space, pulmonary, and here tricuspid area and mitral area. Same picture showing here, aortic, pulmonary, tricuspid, and mitral. So rationale, the pulmonic or pulmonary valve area is the best heart at the second intercostal space, just left to the sternum. But just right to the sternum, second intercostal space is the aortic. Next question, when routinely evaluating an elderly client for atypical signs and symptoms, the nurse should remember that. So the key point is here, evaluate a elderly client. So because of aging, our systems going to degenerative change. So the nurse should remember that aging can reduce an individual abilities to regulate the body temperature. Number two, aging can increase the pain perception. Number three, anesthesia usually causes the post-operative psychotic behavior in a geriatric client. Number four, the risks of developing emphysema is highest in elderly people. So the correct answer is aging can reduce an individual abilities to regulate the body temperature. The rationale, in an assessment, the healthcare provider should remember that aging can reduce the ability to regulate the body temperature, and this not only increase elderly clients' susceptibility to hyperthermia and heat stroke, but also decreases his ability to produce a fever in response to his infection. An elderly client may exhibit decrease the pain perception, and many medications such as anesthetics agents and analgesics can cause confusion or depression in an elderly client. The risk of developing emphysema is the highest in smokers, regardless of the age. So in this picture, we can see normal brain tissues in healthy adult person. But because of aging, the brain is undergo degenerative change and also the brain tissue is going to shrink, and this is actually causes the Alzheimer disease because of aging process. Because of aging, our taste or smell perception go down, dietary habit or peristalsis movement go reduce, or patient feel less of hungry to the food. Also, glucose level increase, insulin level increase, glucagon level increase. Circulation decrease the blood circulation to the tissue. Also, delay gastric emptying. So all of the change occur because of aging. In this picture, we can see the opacity in the lens and cataract formation because of aging. Next question, to assess the effectiveness of cardiac compression during the adult cardiopulmonary resuscitation, or shortly called CPR, a nurse should palpate which pulse site? So radial, apical, carotid, or brachial? Correct answer is carotid. So in this picture, we can see the chin is little bit up, and we feel the mid point of sternocleidomastoid muscle in the middle border, or pulsation of carotid arteries. The explanation why carotid. During CPR or cardiopulmonary resuscitation, the cardiac artery pulse is the most accessible and may persist when peripheral pulses are no longer palpable. Because of decrease in cardiac output and peripheral perfusion, we will not get radial pulse. We do not palpate apical pulse, but still maybe we can feel carotid pulse. The chest compression performed during the CPR can preclude accurate assessment of the apical pulses. Next question. A 2-year-old child is being examined in the emergency department for epiglottitis, means the inflammation of epiglottis. Which assessment finding support this diagnosis? Number 1, mild fever, clear speech, tripod position, and also gradual onset of smoking. So epiglottis, when inflamed, patient has a difficult of shortness of breath, and patient struggling for oxygen, hunger for oxygen, right? So in that position, patient should be sitting like this. It is called tripod position, right? Like mouth is open, right? And neck and chin extended, and also a little bit bent forwards. And here we can see epiglottis is inflamed and blocking and causes the obstruction. Why tripod position? The child being in the tripod position means sitting up and lean forward, and support the diagnosis of epiglottitis because this position facilitates the breathing. Epiglottitis persists with a sudden onset of signs and symptoms, such as the high fever, muffled speech, inspiratory stridor, and drooling. Next question. Which pulse should the nurse palpate during rapid assessment of an unconscious adult. So your patient is unconscious. Which pulse you have to go for the examine or assessment, radial, brachial, femoral, or carotid? Correct answer is carotid. Why carotid? During a rapid assessment, the nurse first priorities is to check the client vital sign or vital functions by assessing his airway or checking the breathings and circulation. To check the circulation, the nurse must assess a client's heart and vascular network function. And she does this by checking his skin color, temperature, mental status, and also, most importantly, his pulse. The nurse should use the carotid artery to check the client circulation. In a client with a circulatory problem or a history of compromised circulation, the nurse may not be able to palpate the radial pulse. The nurse palpate the brachial pulse during the rapid assessment of an infant. The next question, when performing a pediatric assessment, why should a nurse inspect first and then auscultate? Right? So inspection is first, then go for auscultate by use stethoscope. Why? Number one, because the nurse touch may clean the child. Because the child may cry as the assessment procedure and making auscultation difficulties. Number three, because the nurse touch may frighten the child. Number four, because the nurse hands on stethoscope may feel cold and making the child recoil. So this is the reason we try to put it room temperature, right? So it will be not be cold. And number one is not answered because patient came pediatrics department for assessment, right? So the correct answer is because the child may cry as the assessment procedure. So it is good to go for inspection first. What you can see, what you can smell, what you can feel, and then go for put the stethoscope for auscultation. The pediatrics child does not know what are the stethoscope. They feel some invasive procedure is going on. The explanation, because the other assessment procedure may make the child cry, the nurse should auscultate the child lungs right after inspect. Crying increase the respiratory rate and create noise that interfere with the client auscultation. So if any rhonchi, wheezing, or any other sound, we will not get it clearly. Next question, a nurse is taking a client's blood pressure and fail to recognize an auscultatory gap. What should the nurse do to avoid recording an error low systolic blood pressure? So number one, have the client lie down while she takes his blood pressure. Number two, inflate the cuff to at least 200 millimeter of mercury. Take the blood pressure reading in both of the arms and inflate the cuff at least another 30 minutes of mercury after she cannot palpate the radial pulse. The correct answer is inflate the cuff at least another 30 millimeter of mercury after she cannot palpate the radial pulse. The rationale. The nurse should wrap an appropriate size cuff around the child's upper arms and then place the diaphragm of the stethoscope over the brachial artery. The nurse should then rapidly inflate the cuff until she cannot palpate or auscultate the pulse. Then continue inflecting until the pressure reaches another 30 millimeter of mercury. Having the client lie down, inflate the cuff to at least 200 milligram and taking the blood pressure reading in both of the client's arms are not appropriate measuring. So what is auscultatory gap? Auscultatory gap, a gap present after trepanning the sound, and it is seen in hypertensive patient. So systolic blood pressure and diastolic, in between, we can get a gap, which is called auscultatory gap. So let me explain what Lippincott book says. A silent interval that may be present between the systolic and diastolic blood pressure, such as the sound disappear for a while, then reappear. So when you measure the blood pressure, you can get it if patient have it. Orthostatic blood pressure. Measure the blood pressure and heart rate with the patient supine and wait for 3 minutes. And then have the patient stand up and now repeat the measurement. So when patient change the posture, you can take the blood pressure, lying down and sitting. But in between two positions, it is good to wait for 3 minutes. Normally, the systolic blood pressure drops slightly or remain unchanged. Diastolic blood pressure raises slightly. Orthostatics means blood pressure drops more than 20 millimeter of mercury, and diastolic blood pressure drops more than 10 millimeter of mercury. Next question. A nurse prepared to measure client's blood pressure. What is the correct procedure for measuring blood pressure? So you see in this picture, it is sphygmomanometer, stethoscope, diaphragm, and put it over the brachial arteries. And patient hand should be heart level and rest in a support or on a support. So number one, wrapping the cuff around the limb with uninflected bladder, cover about 1/4 of the limb circumference. Number two, measuring the arm about 5 centimeters above antecubital space. Number three, wrap the cuff around the limb with uninflammable bladder covering about 3/4 of the limb circumference. Number four, using a bladder that is 6 inches or 15 centimeters long. The correct answer is number three, wrapping the cuff around the limb with the uninflected bladder covering about 3/4 of the limb circumference. The rationale: when measuring blood pressure, the nurse should wrap the cuff around the child's arms or legs with a bladder uninflated. The bladder should cover approximately 3/4 of the limb circumference. The nurse choose the bladder size according to the size of the extremities. So in a picture, it is showing the blood pressure, normal blood pressure, no occlusion on the blood flow. So we can see this is the artery, blood is flowing. There are no occlusion. But when you put the cuff, right, and inflect it and put a pressure in the artery, and blood pressure supposed to be stopped. Blood flow is off in the lower portion. This is sphygmomanometer or hand pump. And blood pressure, blood occlusion, cuff pressure blocks the blood flow. And we can see or we can hear the sound. Can hear the sound is called Korotkoff sound. When you get the sound first time, this is the systolic pressure. And when the sound will disappear, it is the diastolic sound. And when you release the pressure by a key in the blood pressure machine, again, it cuff will be deflect, pressure will be released, and blood flow will be normal like before. So diastolic blood pressure. And when we cannot hear the pulse, the last sound is called diastolic. Here showing same picture, different way to explain. This is the brachial arteries and blood pressure 120 systolic over 70 diastolic to be measured. Now here, rubber the cuff inflect with the ear, right? And stethoscope in your ear. Pressure is cuff above 120. No sound is audible, right? It is systolic. Pressure of cuff below 120 but above 70. So in between blood pressure. Sound is audible in stethoscope. And pressure in the cuff below 70, no sound is audible. So last is 70 and no sound is audible. Sound will be disappear. Korotkoff sound will be disappear. When you see, when you hear the sound and when you do not hear the sound or disappear the sound, you have to take two measurements. The artery is pinched to a level that heartbeat is not heard because blood flow is blocked, and also reducing it to the systolic level. Heartbeat will be heard because blood started being pumped through, and pumping is detected on arterial wall as a heart beat. Further decrease the pressure to the diastolic level and blood is pressured through, and heartbeat will not be heard through the arterial wall. Next question here. A nurse is auscultating a child's lungs. Identify the area on the client's vertebra and representing the base of the lungs, where the nurse expects the breath sound to end at the end expiration. So this is the lungs, and this is called apex of the lungs, and this is the base of the lungs, right? So this question asking what vertebral level the lungs is finished. Is it here? Is it here? Or is it here? So what are the last vertebra that touch the base of the lungs. The correct answer is this level, right? Thoracic 10. So a rationale, using posterior landmarks, the lungs extend from vertebral area to the level of the 10th thoracic vertebra. So here to here, all is vertebra, but this area is called cervical vertebra, and this is called thoracic vertebra, and after that lumbar vertebra. So lungs is finished up to the 10th thoracic vertebra. Next question, a 82 years old client is admitted to the hospital with a diagnosis of pneumonia. The nurse learns that the client lives alone and has not been eating or drinking properly. When assessment the client for dehydration, the nurse would expect to find. So your patient diagnosed the pneumonia, infection of the lungs, and 82 years old. Your patient do not eating enough or do not drink enough or properly, may be dehydrated. So what are the signs of dehydration? Distended jugular vein, hypothermia, hypertension, or tachycardia. The correct answer is tachycardia. What are the rationale? With an extracellular fluid or plasma volume deflect or reduce, the compensatory mechanism stimulate the heart and causing an increase in heart rate. Because our body try to compensate. Because of lack of drinking, blood volume go down, blood pressure go down, but your tissue need oxygen, and your heart should be try to give, or your heart to try to supply the oxygen to the tissue, but your resources is less, demand is increased. So distended jugular vein and hypertension may be the sign of fluid volume overload. The body temperature may be elevated with dehydration. Blood pressure is particular systolic blood pressure or fall with the dehydration. Or orthostatic hypotension may occur. The next question here, to evaluate a client reason for look for the care. A nurse perform a deep palpation. So what is the nurse go for assessment? So palpation is one of the technique of physical examination. We have a deep palpation and superficial palpation. Usually deep palpation we do for skin trigger, hydration, organ, or temperature. So definitely deep palpation for palpate the organ. So in this picture, we can see the deep palpate over the liver, spleen, and other abdominal organs. So the purpose of deep palpation, in which the nurse include the client skin approximately 3.8 centimeters. So this man is putting little bit pressure and is to assess underlying organs and structure. Is it hard or soft in consistency? Is it enlarged, palpable, or not? Such as the kidney and spleen. So if kidney is palpable, we call palatable kidney. And if spleen is palpable because of enlargement, we call splenomegaly. The nurse can assess the skin trigger, dehydration, and temperature by using light touch or light palpation. Next question, a client complain of abdominal pain. Which question should the nurse ask the client? So patient complain he or she has an abdominal pain. So what should be your next question? Number one, are you having the pain? Patient came to you because of abdominal pain. It is not necessary. Again, same question asked. Number two, is the pain consistent? It is a good question, but it is closed question. Means patients will be say yes or no. You will not get enough information. Number three, is the pain sharp? It is also closed question. Answer question. Patient will answer yes or no. Will not get enough information. Number four, what does the pain feel like? So this is the question is open-ended and your patient can explain elaborately details. The correct answer is number four, what does the pain feel like? The rationale in open-ended question means one that cannot be answered with simple yes or no. It's open-ended. Also provide more information than a closed-ended question like, is the pain consistent? Is the pain sharp? It is closed-ended question, which limit the client response and always we encouraging them to verbalize their complaint. It is a therapeutic way of communication. The other option are closed-ended question too. So right answer is the number four.